Okay. Event will start at 5. Event start हो गया.
थोड़ा सा ऐसे करिए ऊपर ये कॉर्नर पे जो नजर आ रहा है इसका एंड पोलियो का.
उससे confirm कर. Hello everyone. On behalf of the Global Polio Eradication Initiative, I'm pleased to welcome you to today's event, delivering on the promise of polio-free world. I am Dr. Ujala Nair, a WHO surveillance officer in Pakistan, and I'm honored to serve you as your moderator. I joined you today from the Punjab province in Pakistan, one of the 2 countries in the world where the wild poliovirus still remains. Ending polio is an urgent mission. Alongside my team, I spend my days looking for any trace of the virus and investigating reports of the paralysis that might be polio, all in this hope that we can soon give our children a future, an extraordinary gift, a life free from the fear of polio. Of course, the COVID-19 pandemic has greatly impacted all facets of life around the globe, including polio vaccination campaign, which were temporarily paused to protect the children, families, and the healthcare workers. But as we all hear today, the polio program has never really stopped working. During the next hour, we'll have the honor of hearing from the global partners, leaders from the polio-affected countries, and others working tirelessly to stop this virus. We will also hear about the new polio eradication strategy for 2022 to 2026, which aims to urgently overcome the remaining hurdles to eradication, strengthen health systems in affected countries, and ensure that all children are protected from the preventable diseases. If you would like to join the conversation around today's event online, you can use the hashtag #polio. While polio campaigns were temporarily paused, the program pivoted its resources to support the COVID-19 response. During the first part of today's event, we'll hear from the GPEI leadership about how the polio program operated during this challenging year. Yes, this is not the first time polio assets have been used to support other health emergencies. In 2014, the program Emergency Operations Center model was replicated to support Nigeria's response to Ebola, helping limit the spread of the disease. Whether it's on extensive surveillance network or deep knowledge of how to build the communities, trust in the communities, the infrastructure and expertise developed by the program has proven to have a broad and significant impact across the public health. The partnership between health workers, governments, community leaders, Rotary volunteers, and global partners is crucial to today's eradication efforts. I would like to now introduce Dr. Chris Elias, the chair of the GPEI Polio Oversight Board, who joins us live from Pakistan to discuss the importance of these partnerships.
Thank you for that warm welcome, Dr. Nair. As chair of the Polio Oversight Board, I would like to welcome everyone to this launch event of the new strategy to achieve a polio-free world. I'm sending my greetings from the National Emergency Operations Center here in Islamabad, Pakistan, where I'm thrilled to be joined by program leadership across the country, regional, and global levels of the Global Polio Eradication Initiative. This launch comes at the conclusion of a 6-day visit by a delegation from the POB to Pakistan, where we've had an opportunity to visit several provinces and meet with leaders from the government of Pakistan. I'd also like to especially thank Prime Minister Imran Khan and Special Assistant to the Prime Minister, Dr. Faisal Sultan, for their kind hospitality in hosting our delegation during this visit. It's been wonderful to see firsthand their renewed energy and commitment to implementing the new tools and tactics that are outlined in the new GPEI strategy to urgently achieve a polio-free Pakistan. The Global Polio Eradication Initiative looks forward to continuing to partner with the Pakistan government, as well as political leadership from all countries that are still affected by polio, to protect and improve the health and well-being of every last child. We'd also like to acknowledge the heroic efforts of frontline workers and all those who ensure their safety and security, who go door to door to make sure that all children, no matter where they live, are protected from this paralyzing and vaccine-preventable disease. On behalf of everyone here, thank you for joining us today, and thank you, most importantly, for your commitment to a polio-free world. I'd now like to share a video message from the Polio Oversight Board reflecting on where we are with the eradication effort. Thank you.
To every partner joining us today from around the globe, thank you.
Your dedication to ending polio fuels incredible progress against this disease.
Your work has saved millions of children from lifelong paralysis.
Our work now faces a tipping point. Like so many health programs, polio eradication efforts suffered when the COVID-19 pandemic began.
Last year, we made the difficult decision to pause immunization campaigns for several months
to protect communities and health workers from the pandemic,
and to urgently support countries in the COVID-19 response with polio staff and resources.
While our support continues, the pause in polio work came at a cost.
Millions of children missed their polio vaccinations in 2020, and the pandemic intensified many challenges we faced prior to COVID-19's emergence.
The world has come so far against polio, and we cannot afford to lose momentum now in our efforts to reach every last child.
This is a more critical time than ever.
The Global Polio Eradication Initiative is launching a new strategy to recover lost ground and come back even stronger, continuing its history of learning and adapting in the face of challenges.
We are building on our experience in delivering vaccines in the most challenging environments to ensure that every last child is protected against polio.
We will continue accelerating the integration of polio activities with essential health services like delivering other vaccines and maternal health services so that we can better meet the needs of vulnerable communities.
We are innovating to deploy new tools such as a modified oral polio vaccine that could help countries more sustainably stop outbreaks of type 2 CVD-PV.
And we are centralizing our commitment to gender equality by ensuring that everything we do empowers women across all levels of the program, from global leaders to frontline workers.
As COVID-19 demonstrated, the polio program is also essential to protecting communities against multiple diseases, and if its assets are maintained, can help countries prepare against future health threats.
But the future of this work and the success of the new polio eradication strategy will only be possible with additional sustained support from all partners.
We remain truly committed to achieving a world where no child lives with the threat of polio.
And we urge our donors and partners to stay strong in their commitments until the job is done.
With renewed collaboration, resources, and commitment from donors, governments, and partners everywhere, a polio-free world is possible.
Together, we will achieve it.
It's powerful to be reminded of all we have already accomplished in the effort to end polio and how our partnership continues to come together in this initiative. I would like to now introduce colleagues from the Eastern Mediterranean region, as well as from Nigeria, to discuss how people, networks, and tools of the polio program were able to quickly adapt to challenges brought on by the COVID-19 pandemic.
In 2020, we have witnessed the real value of investment in combating polio in the region, building health infrastructure and workforce. This has been reflected in confronting the COVID-19 pandemic. And today, we need to pay attention to the polio situation as a public health emergency that raises an international concern. Eradication will be an achievement and a blessing, not just for the last country to stop transmission, but for the world. I was honored to be elected as co-chair of the first meeting of the Sub-Regional Committee for Polio and Outbreak Eradication in March this year. Ministers of health from around the region came together to discuss ways to overcome the challenges to complete eradication. Our work involves enormous challenges, including funding and access, particularly those living in areas of conflict and insecurity, and promote the establishment of essential health services in communities where polio is embedded. It's vital for us to ensure these assets are well utilized and integrated into national health systems, in particular to strengthen immunization and emergency response systems. As the only remaining polio endemic region, there is real commitment in the region to own the eradication efforts.
We don't have to wait for the next pandemic to prepare. We have to make sure that the lessons that we've learned from polio eradication remain with us. We have to sustain the efforts around public health, strengthening capacity building, and it's going to take a lot of collective efforts and making sure that the right investments are made.
Next, we'll hear from the people working in the communities to end polio and learn about the innovations that will help us make this goal possible. From responding to misinformation to vaccinating children in hard-to-reach areas, polio workers are giving their all to overcome challenges. Women frontline workers are knocking on every door to ensure no child misses the vaccine. Carrying sanitizers and ensuring they clean their hands before touching every child is time-consuming. And wearing a mask is tough in such hot weather, but they do it without complaint. These women are central to eradication efforts. Let's hear from Hafsa, a community health worker and polio vaccinator, about a day in her life.
जब हम लोग सेशन करवाते हैं तो वो डिफरेंट क्वेश्चन जो है ना वो रेज करते हैं कि ये हमें क्या पता वैक्सीन कैसी है कैसी नहीं है, मेडिकेटेड ठीक नहीं है, मतलब ये हमारे बड़े बच्चों की सेहत ये ठीक नहीं है। तो और इसी को फिर मैं आगे जब जॉब में आई हूँ तो तब भी मेरा यही काम है कि लोगों से मैंने मिलना जुलना, उनसे बात करना, उन्हें कन्विंस करना, उन्हें बताना। हमारा एक प्लान बना होता है ना सारा कि हम लोगों ने आज क्या काम करना है, क्या नहीं, हमने कौन से इन्फ्लुएंसर से मिलना है, कौन से डॉक्टर से मिलना है, कौन से स्कूल प्रिंसिपल। अगर हम लोगों ने किसी इमाम साहब से मिलना है तो हमने हमारे पास जो है उससे रिलेटेड जो है मटेरियल होता है, फॉर एग्जांपल फतवा बुक हो गई है, इस तरह से हमने उसके मुताबिक जो है सारा अपना होमवर्क किया होता है। ये मेरा एम भी था कि मैं कोई ऐसा ही काम करूं कि जो कि लोगों को जिससे फ़ायदा हो। समटाइम लोग कह देते हैं, बेशक फीमेल ही बात करते करते, जैसे औरतें तो घरों में अच्छी लगती हैं, आप लोग ना निकला करो, मर्द ठीक हैं, इस तरह की बातें जो है ना, जब उन्होंने इस तरह से मुझे कहा तो फिर मैंने उन्हें मतलब इस तरह से ना उन्हें बताया कि अगर आप लोग नहीं, मतलब मेल से तो आप लोगों को अलाउ नहीं है बात वगैरह करना, फिर अगर हम लोग नहीं आएंगे तो आप लोग कौन सुनेगा, या आप लोगों को कौन आके बताएगा। रिसेंटली जो है मुझे यहाँ पे एक रिफ्यूज़ल था। मैंने उन्हें पहले बताया कि देखें, अब पहली बात कि मैं ये फील्ड में हूँ, मैं अपने बच्चों को अगर ये पिलाती हूँ तो इससे बढ़ के और क्या मुझे इससे ज़्यादा कुछ और अजीज़ होगा। फिर बाकायदा मैंने उन्हें वीडियो निकाल के दिखाई, मैंने अपने बच्चे की से तस्वीर दिखाई, मैंने थोड़ा सा पर्सनल होकर उन्हें यूज़ किया कि मैंने अपने बच्चे की तस्वीर दिखाई, ये देखिए मेरा बच्चा है 5 साल से छोटा है, मैंने खुद ही से पिलाती हूँ ड्रॉप्स। तो ऐसा इसलिए कुछ नहीं है, हम लोगों ने पूरी इस पर तहकीक की हुई है, हम लोगों ने सारे इसके डॉक्यूमेंट्स वगैरह देखे हैं, पढ़े हुए हैं, तो आप परेशान ना हो, आप बिल्कुल इत्मीनान करके आप पिलवाएं। मेरा ये पहले दुआ भी है और ख्वाहिश भी है कि इस बीमारी से अल्लाह ताला मेरे बच्चों को और बाकी जो तमाम बच्चे हैं उन सबको जो है वो दूर रखे, और इंशाअल्लाह ताला एक दिन ज़रूर जो है इससे जो है पोलियो फ्री पाकिस्तान हो जाएगा।
Commitment to eradicating polio at all levels is essential to improving the quality of our work, from frontline health workers to GPEI leaders. I would now like to introduce two of the GPEI leaders, Aidan O'Leary, Director of the Polio Eradication for WHO, who is also joining us from Pakistan today, and Dr. Anuradha Gupta, Deputy Chief Executive Officer for Gavi, the Vaccine Alliance. I'll be asking them both a few questions to learn a bit more about the GPEI's new strategy. Hello, Dr. Aidan and Dr. Anuradha.
Hello. Good evening. It's great to be here.
Okay, I would like to direct the first question to you, Aidan. The fight against polio from 1988 to the present day demonstrate human ingenuity and resourcefulness, human capacity to persevere and succeed when there is collaboration and desire to conquer the disease. We heard from the Polio Oversight Board members about the new GPEI strategy. What is the most important factor in the success of this new strategy?
Thanks, Uzala. The new strategy, delivering on a promise, reaffirms that our goals are to eradicate wild poliovirus and interrupt circulating vaccine-derived poliovirus across the globe. Of the strategy's five strategic objectives, strengthened country ownership and strengthened community ownership are the decisive shifts that we are seeking to achieve. As we've all seen during the COVID pandemic, adopting an emergency tempo with a whole of government approach, decision-making on real-time data, and accountability for follow-up actions are prerequisites for success. To strengthen acceptance, confidence, and trust, the program also recognizes that we must become much more responsive to the wider needs of the most vulnerable and underserved communities, more welcoming and understanding of sociological and anthropological expertise, and much more closely integrated with social and health programs that deliver interventions that meet communities' priority needs. Both of these factors are absolutely critical if we are to reduce the number of missed, unvaccinated, and unprotected children in the remaining polio reservoirs to zero. Thank you.
Thank you, Aidan. Anuradha, when we talk about collective engagement, what will it mean in the field? How will the program reach the zero dose and missed communities and ensure that every child is protected against polio?
So thank you, Dr. Ojala, for that wonderful question. It is great to see GPEI's a new strategy focusing on collective engagement, and that too around zero dose children and missed communities. During my work in India on polio eradication, my most important learning was the enormous value of bringing laser focus on those children who were consistently missed by both routine immunization and polio campaigns. Only by winning the trust of these communities that are home to zero-dose children and successfully reaching and vaccinating these children were we able to get India over the finish line. Our new Gavi strategy too embraces the goal of reaching those 11 million zero-dose children in Gavi-supported countries who do not unfortunately receive even a single vaccine shot. Why it is important to us? Because we know that though only 1 in 8 children is zero-dose, they account for 50% of vaccine-preventable deaths and are often the epicenter of disease outbreaks, including polio and measles. Zero-dose children also embody communities that are extremely poor and suffer from multiple deprivations such as low access to reproductive health, nutrition, sanitation, water, hygiene. And these are further compounded by gender and other barriers such as ethnicity. We are thus delighted that GPEI's new strategy aligns with Gavi and IA 2030 in calling for attention to zero-dose as well as integration. Missed communities that are home to zero-dose children urgently need polio and other life-saving vaccines, but also multiple other services. And understanding their needs and responding with integrated service delivery, I think would help build public trust in immunization, institutions, and governments. There is no better time to do it than now, as the pandemic has further exacerbated inequities with more than 150 million people likely to slip into extreme poverty by the end of this year. I think failure to focus on zero-dose children would mean more child deaths, disability, disease outbreaks, and medical impoverishment. But reaching zero-dose children would be daunting and require us all to work together and in new ways. I think we would need localized approaches and would have to work with a range of new partners, including CSOs. But I really do feel that by collectively committing to a more holistic approach to immunization, listening to communities and embracing context-appropriate strategies and partnerships to reach these zero-dose communities, Gavi, GPEI, and IA 2030 can achieve results that all of us are aspiring to see, including eradication of polio.
Okay. Aiden, as you know, that 2020 was a hard year and the program showed CVD-PV2 cases rocket high. What are the innovations in this polio outbreak response the new strategy brings in?
Many thanks, Uzala. You're absolutely correct. We had 1,088 CVD-PV cases recorded from 2022 countries in 2020. Luckily, we are seeing the numbers reducing to 100 in 2021 to date, and the geographical focus is narrowing. I think there are 5 key areas that we're looking to focus on in the new strategy. Firstly, we're hoping that governments will declare national public health emergencies when our cases are notified. Secondly, we have the benefit of a new tool, the novel OPV2 vaccine, which has been developed and given approval under an emergency use listing in late 2020 and is now being rolled out at pace. Thirdly, what we're hoping is that we will have more timely detection of both new cases as well as our ongoing environmental transmission. We're looking to also make sure that we have more timely and better quality outbreak response to make sure that more missed children or children at high risk are vaccinated. But then last but not least, what we really want to do is to work on prevention, not cure. And this is where we hope to work to strengthen essential immunization to really make sure that we reach these zero-dose children and communities and deal with the problem at source to make sure that the problem doesn't recur going forward. Thank you.
Thank you. Okay, traditional standalone polio vaccination activities are no longer able to achieve sufficient coverage. Anuradha, what is your view on the ambition for the polio program to move from a vertical program to a more horizontal one? Or what progress we are seeking or achieving?
Yeah, so this is critical from my perspective. I also think COVID-19 has been a catalyst, forcing us to think differently. Financial and human resource capacities in countries we know are extremely, extremely stretched. And that makes it imperative to adopt more efficient and integrated approaches. This is also what communities need and are now demanding. When I took over the reins of polio program in India in 2010, India accounted for half of global polio burden. There was high program fatigue and repetitive national and subnational polio campaigns were yielding diminishing returns. It was only by doubling down on missed children that we turned the tide. And in the process, we learned that single disease focused, highly vertical strategies are unsustainable. Communities begin to push back on repetitive vaccination to protect against a single disease. They want to understand why the children are being given multiple doses beyond what is necessary and why their other health and development needs are overlooked. This fuels vaccine hesitancy and rumors. We saw this not only with polio campaigns, but also measles more recently. Cases of circulating vaccine-derived poliovirus also remind us that even after wild poliovirus is stamped out, low coverage of routine immunization and essential health services can be detrimental. And therefore, for polio eradication to succeed in the time frame laid out in the strategy, integration is essential with focus on building more resilient, efficient, and inclusive health systems. We are so delighted to see the new GPEI strategy and its focus on integration. And we are already seeing progress with GPEI and Gavi working together to increase access to essential immunization services in the southern region of Afghanistan, for example, and the high-risk districts in Pakistan. This includes implementing birth dose OPV in health facilities, integrating operational microplans, for example, enhancing supportive supervision, harmonizing social mobilization and health promotion efforts, and using new technologies such as mobile money, GIS to support program operations and accountability. I think this is just the beginning, but a very exciting one, and we look forward to doing so much more together.
So how would you take it, Aiden, this verticality towards more horizontal program?
Thanks, Uzala. And I think I would simply complement what Anuradha is saying by just to note that we are all aware that the polio virus flourishes in underserved communities. And for an eradication program, what we need to do is to move from an ad hoc and patchy approach to one that is much more comprehensive and systematic with focus on reaching and vaccinating zero-dose children and communities wherever they may exist. For GPEI, what this really means is a highly targeted approach towards the inaccessible children of Pakistan or of Afghanistan, to the zero-dose children and communities in the underserved areas in the core reservoirs of Pakistan. And as we touched upon a little earlier, really focusing in on the zero-dose communities that are driving these CVDPV outbreaks wherever they may exist. On top of that, the polio eradication program will continue to make its staffing, its infrastructure resources to support COVID vaccine 19 introduction and delivery in all those countries where we are required to do so. So we are very, very much committed to these joined up approaches that will certainly help us bring us closer to zero. Thank you.
All right. Anuradha, you mentioned these gender barriers in relation to reaching zero-dose children and missed communities. Why is applying a gender equality so important, and how can gender-related issues or barriers be addressed?
So gender equality is a very powerful determinant of health outcomes. In India, the last polio case that we saw was of a young girl called Ruksar. Her brother was vaccinated, but she was not vaccinated. And though we pride ourselves on gender parity in immunization, particularly polio, there are still gaps that need to be addressed. And Ruksar's story is a very live example. We also just heard from Hafsa, how important is the role of female vaccinators, in enhancing community trust. We have seen that in India, where SMNet volunteers from communities played such a beautiful role in bringing communities along and responding to the questions and doubts that Hafsa was so eloquently alluding to. So I do think we need to pay much greater attention to gender barriers, including low agency of women, and also the role of female health providers, and really increase women's meaningful participation in decision making and also leadership roles. COVID-19 has shown a light on the value of women in leadership, and I think we ought to pay attention to some of those lessons.
And Aiden, I'll ask the same question to you. What do you think, how can these gender equalities be addressed? Inequalities.
Thanks, Zala. So I think for the polio eradication program, the single most important relationship is between a frontline vaccinator and the caregiver for a child, which is usually the mother. Well-trained and supported female vaccinators who are drawn from the local communities they serve and who enjoy relationships of mutual confidence, respect, and trust are what converts a knock on the door to the successful vaccination and protection of all the children inside the household. So for polio eradication, this is a critical program imperative, and the strategy strongly supports an environment and all measures that will maximize the prospects of their success. In this strategy, we also hope to build on and incorporate the GPEI gender equality strategy launched in 2019, and we will work closely to track our achievements against those targets. So we are very serious about it. We really want it to work. Thank you.
Thank you very much, Aiden and Anuradha, for this introduction to the strategic highlights. And we are really glad to have you both. As you people heard from Aiden and Anuradha for the great overview of how the GPEI is adapting and adjusting to current times with this new strategy. One of the innovations they touched on novel OPV2 is already being rolled out in 7 countries. Let's hear from some of the researchers behind the development and rollout of this innovation.
The world has made incredible progress towards eradicating polio thanks to the oral polio vaccine, or OPV, which has helped reduce polio cases by over 99% since 1988. This vaccine is easy to administer, and it has the amazing ability to both protect the individual and prevent person-to-person spread of the virus. Unfortunately, though, if not enough children are vaccinated, the weakened poliovirus contained in OPV can start to circulate in a community, and over time, change to a form that causes paralysis. This variant of poliovirus is called a CVDPV, and it's one of the major barriers we face in achieving a polio-free world.
To address the threat of CVDPV, a global group of experts have worked together for many years to develop a next-generation vaccine, one that would carry less risk of changing to a harmful form that could cause paralysis in low immunity settings. The result is the novel oral polio vaccine type 2, or NOPV2, to address the most common type of CVDPV, type 2.
NOPV2 is very similar to the current saving OPV we rely on, but with key changes to prevent mutation. The vaccine has been safely tested across all age groups, including children and infants in Panama.
In Belgium, we even built a self-contained village, Poliopolis, for people to live in as they took part in the adult study. Across all studies, we have seen that NOPV2 is safe, effective, and significantly less likely to change to a form that can cause paralysis.
The clinical results have been hugely encouraging, and these results informed a thorough and independent regulatory review that enabled WHO to recommend NOPV2 for deployment under an emergency use listing. This allowed the vaccine to be used urgently to stop CVDPV2 outbreaks and address polio as a public health emergency of international concern. The polio program has worked hard with countries facing or at risk of a CVDPV2 outbreak to prepare for NOPV2 rollout. This has meant ensuring governments and regulatory authorities are fully engaged and leading the process, training frontline health workers, and sensitizing communities.
It was amazing to see NOPV2, after a decade in the works, begin to be rolled out from March 2021. We look forward to seeing more countries across different continents using this vital new tool in the future to combat CVDPV2.
NOPV2 is a powerful example of the polio program's innovation to overcome the toughest challenges. Partners, scientists, and leaders from around the world made NOPV2 possible, and this is the kind of collaboration that will help us end polio for good.
We are confident that this vaccine could help us stop CVDPV2s and bring polio eradication within our grasp. However, a vaccine sitting in a vial won't protect a child. We must all continue to reach and protect children everywhere and recommit to wiping out this terrible disease.
The only way we are going to end polio is if the global community comes together to take collective action and mobilize resources to reach all children. The governments of polio-affected countries have even more important role, and their accountability is what will bring us closer to zero cases. In the last portion of the event, we'll hear directly from some of the countries that are committed to delivering on the promise of polio-free world. With wild polio virus only circulating in countries Pakistan and Afghanistan, we are closer than ever to eradication. One of the ways we are doing this is by supporting the expanded program on immunization and other vaccinations, which bring mass vaccination campaigns to the hard-to-reach areas from the far-flung deserts to snow-covered mountain ranges. I would now like to introduce Pakistan's Special Assistant to the Prime Minister on Health, Dr. Faisal Sultan, who will discuss the country's commitment to wiping out this virus once and for all.
Greetings from Pakistan. I'm happy to be part of the launch of the new strategic plan to secure a lasting polio-free world. Together with your support over the last quarter century, we have built an infrastructure to help manage and respond to not only polio eradication, but as you might have seen, these tools and infrastructure helped in our response to COVID-19 as well. It shows the value of having and maintaining such infrastructures that tackle not just individual diseases, but are able to retool and redirect to other public health emergencies as well. We now must work in close coordination and integration with the broader immunization programs and services. And this can only happen with a holistic approach to immunization in general and, of course, to polio in particular. Now, the new roadmap, however, is just a guide. It's a roadmap. And therefore, we do truly appreciate the efforts of the GPEI in laying it out for us. But getting to the end of the road requires that we focus on optimization of this plan and implementation of this plan. And this will require coordination and concerted efforts across many domains. Today, I would like to assure you that we are fully committed to implementing this roadmap launched today. But I'm also here to assure you and to show the commitment of the government of Pakistan and this office, that of the Ministry of Health, to ensuring that we will follow this and we will have a coordinated, concerted implementation of this across all layers. And this includes provincial leaderships, district leaderships, and down to the last mile, to the health workers, and of course, to the parents of those children who potentially are at risk for this disease and who need to be very important partners for us in the implementation of this plan. Now, I'd like to extend my sincere gratitude to a number of people and to our global partners, of course, ably assisted and led by thousands of Rotarians internationally who have given tirelessly their time and their money and their effort and their dedication. I urge you once again to redouble your efforts while we redouble ours. Thank you, and I wish you all a very successful implementation and rollout of this strategic plan that you've all put together and that is being launched today. Thank you very much.
Thank you very much to Dr. Faisal Sultan. I now have the honor of introducing the Afghanistan Acting Minister of Public Health, Dr. Wahid Majroor, who will discuss the steps Afghanistan taking to overcome the recent hurdles.
Assalamu alaikum wa rahmatullahi wa barakatuh. Dear partners and friends in this global effort to eradicate polio, I send you my warmest greetings from Afghanistan and thank you for the opportunity to address you today. Together, we have come a long way since Rotary International launched this global effort to eradicate polio in 1985. At that time, polio ravaged virtually every country in the world. And by the start of 2020, only 2 countries remained endemic to wild polio virus. One of those is, of course, our own country, and we felt confident that we would rapidly eradicate polio here as well. But then, as we all know, everything changed. COVID-19 emerged. Polio campaigns were temporarily paused, and more children were left vulnerable to disease such as polio. As one of the largest health initiatives in Afghanistan, the polio program stepped up to support government's COVID-19 response. The program provided and continues to provide support in COVID-19 surveillance and raising public health awareness. Despite challenges caused by COVID-19, rising insecurity, and the continued ban on house-to-house vaccination in certain areas, we administered more than 36 million doses of polio vaccine in 2020. Today, I can say with great pride that the program has made significant progress in stopping the importation of wild polio virus to polio-free areas across the country. Just 1 wild polio virus case has been confirmed since October 2020 to date. We have also made strides in containing wild polio virus cases to the eastern and southern regions. In the East, no new poliovirus cases have been confirmed since March 2020. In South, transmission has declined with no new cases reported since October 2020. Circulating vaccine-derived poliovirus type 2 transmission has been addressed and contained in the accessible areas of the country. These are no small successes, but challenges persist. Inaccessibility due to the continued ban on house-to-house vaccination in certain parts of the country continues to prevent us from reaching all children everywhere. We cannot end polio unless we're able to vaccinate all children everywhere. I strongly urge all parties to allow vaccinators access to all children. In knowing our challenges, we also know exactly what we need to target our eradication strategies more effectively. We must now focus entirely on operational implementation. If we optimize implementation, success will follow. And that is what this new strategic plan is all about. Friends, I wish to assure you of our government's and partners' unwavering commitment to implementing the new strategic plan we're launching today. We're fully committed to eradicating polio from our country and joining the 99% of the rest of the world in being polio-free. Together we have come so far. Let us take this final step together. Let us make the dream of a polio-free world a reality. Tashakur, Manana, thank you.
Strong commitment from the endemic governments has been the key in making progress to date. WHO's African region demonstrated just how important that is by ending wild polio virus last year. That said, there is still much work to be done to address circulating vaccine-derived poliovirus outbreaks. This is a key part of the GPEI's new strategy launching today, and governments in the African region must also keep up their commitment to finish the job on polio. Now let's welcome our final speaker of the day, Bill Gates, co-chair of the Bill and Melinda Gates Foundation, who will also discuss his take on what's needed to get to a polio-free world.
Hello. Thank you all for joining us today. The world has been working to eradicate polio for almost 35 years. Our foundation joined the fight almost 15 years ago. And in all that time, I cannot think of a more important moment than right now. We have the skills, the tools, and the roadmap to finally wipe this terrible but preventable disease off the face of the earth. The GPEI has a long record of successfully adjusting its approach to eliminate the disease in country after country after country. We have the commitment and expertise of the courageous leaders who have spoken today and the millions of workers and volunteers they represent. We have cutting-edge tools developed specifically to address key challenges. And we have the new GPEI strategy that incorporates emerging best practices about integration, digital technology, and gender equality to lay out the path for ending polio forever. At the same time, and to be blunt, we are also closer than ever to losing the gains we have fought so hard for. Outbreaks of different forms of polio continue to crop up in Africa and parts of Asia. We still aren't reaching areas of Afghanistan and Pakistan. And with the pandemic interrupting campaigns, routine immunization, and disease surveillance, all these challenges have become even more daunting. The strategy launching today addresses these challenges. It also includes stronger integration with other health programs, which will ensure that every investment in polio is also an investment in overall health and well-being. But there is less certainty than at any time I can remember that GPEI will get the funding and support it needs to execute the strategy and achieve a polio-free world. Some donors and partners are all in. For example, I've never seen anything like Rotary's decades-long fight against polio. The persistence of countless Rotarians around the world gives me hope that when people are able to really see what global health is all about, they want to get involved, stay involved, and see the job through. But others are wavering in their support. If GPEI doesn't identify substantial additional resources soon, there is a real possibility of failing on the world's promise to end the threat of polio for children everywhere. I urge everyone to think carefully about the consequences, not just for polio, but for global health overall. We cannot do this alone. For years, we've measured the effectiveness of the polio program by counting cases and countries. Indeed, millions of people are walking today who would be paralyzed were it not for GPEI. And 5 out of the 6 WHO regions are certified free of wild poliovirus. During the pandemic, however, we have been reminded that GPEI is a precious resource for addressing a wide range of health emergencies. In the critical first weeks and months, the polio infrastructure doubled as the COVID-19 infrastructure in many countries. Frontline polio workers in 50 countries tapped into their networks and engaged communities to help slow the spread of disease. Emergency operation centers that had already helped manage outbreaks of other diseases, including the Ebola crisis in 2014, cut through chaos and confusion to guide the immediate response in key countries. The Global Polio Laboratory Network, which consists of 145 labs worldwide, has also supported COVID-19 surveillance efforts. Some casual observers may think polio eradication in the age of COVID-19 is not as important as it once was. I think it's even more important. GPEI's assets are key not only for ending polio and all the suffering it causes, but also for detecting and responding to other major health emergencies. That's a win-win investment. In closing, I have confidence that with adequate support for this new strategy, we can succeed in securing a world where no child will ever be paralyzed by polio again. And I ask you to stay committed to the fight. Thank you.
Thank you to Mr. Gates and all our speakers and to all of you who have joined us today. It is clear that the polio eradication effort is one of the best examples of what's possible when the global community comes together. The new strategy will bring us over the finish line for polio while we build long-lasting critical health infrastructure. The commitment to eradicating polio is stronger than ever, with renewed dedication from government leadership, GPEI partners, and frontline health workers. Finally, I want to reiterate our thanks to all frontline health workers and those who support and protect them for their unwavering commitment to vaccinate all children and to bring on end to this preventable disease. We look forward to the continued sustained support from the donors to help ensure that successful delivery of this new GPEI strategy that we have launched today. We thank you for everything you are doing to end polio once and for all. Thank you.